As a parent of an adult son with developmental disabilities, I'm really concerned about Medicaid and those issues, and help me understand how he would not, and people like him, would not lose services and supports that are vital to their day-to-day life through block grants. And also, not just people with disabilities, but I had a mother who, as a single person for 30 years, because my dad passed away, was a good steward of the little funds that she had, but then at the end of her life relied on some help with long-term services. And to me, our elderly population and people with disabilities would come out hurting through a block grant.
Well, good question, and I think that the government is there to help those vulnerable populations, and that's why when you look at a lot of these programs, and Medicaid is a good example, that there are several buckets within Medicaid. You have people like your son who needs that help. You have people who need long-term care, the elderly. You have children who get assistance from Medicaid. And then there are some able-bodied adults that hopefully can transition out of Medicaid and into the workforce to a place where they can get some sort of health coverage outside of the government in the private marketplace. But the way I would understand a block grant program to work, and there are different versions of that. There's a straight block grant, there's a per capita block grant, that the per capita would break down based upon each of those sort of buckets I talked about. So the folks who are going to be the higher cost there are going to have a much higher per capita allocation than, say, for example, somebody in the able-bodied adult category. But there are about 5 categories within Medicaid, all of which would have a separate allocation per capita amount based upon sort of history of what those needs are and what those costs are. I don't know if that helps, but I can't envision a scenario where somebody like your son wouldn't have that program and all that it does to help him available to it.
So we talk about versus, and that's what my hope is, if we change, if it moves to that we focus on the per capita versus block grant.
I think that in its current incarnation, and again, these things are very fluid at the moment, and I'm talking sort of a little bit out of school because at the moment this is a House proposal. We've not taken this up in the Senate. But the current incarnation of what they're looking at, I believe, has those various silos, and the per capita amounts would be significantly higher to match the needs for people in those areas where they're going to have the highest costs. So now, can there be savings achieved by giving the states more flexibility to design some of these programs? I mean, I think you could argue that you would see significant savings. How much is something that all the Congressional Budget Office folks are trying to determine, and that's going to be ultimately, I think, how some of these decisions get made.